So this is going to be a complete change of gear from the previous talk. I'm going to speak more about principles and policies associated with the Human Cell Atlas. This has to do with equity and our commitments to humanity. This entire talk has been polished by the co-chairs of the Equity Working Group, but also has been value-added and endorsed by the Organizing Committee and the Ethics Working Group of the Human Cell Atlas. The three co-chairs of our Equity Committee are Musa Malanga, Alex Shelek, and myself. And on behalf of all of us, I'm making this presentation. I'm going to start with a warning that was given several years ago, 12 years ago, by Charles Rotimi and Lynn Jordy, where they said that genomics provides novel insights into the causes of and susceptibility to disease and adverse reactions to drugs. And they warned that genomics is a double-edged sword. If used carelessly, genomics may exacerbate disparity. And this is where we are concerned, and this is where we are coming up with principles and policies. And so essentially what we want to do is to use genomics in a more precise way. And our belief is that precision genomics can actually promote health equity and not exacerbate disparities if we are careful enough from the beginning while we are embarking on these studies. I'll just give one example where precision genomics has actually helped, and we are talking about CML, which is a cancer of a special kind of cancer of the blood and bone marrow. And it usually does not afflict children, but when it does afflict children, it's devastating. In the 1960s, about four children survived CML, but because of certain understanding of the disease based on genomics today, in 2017, 92 of the 100 children who get afflicted with this kind of cancer survives, and today it's even more than that. The understanding came from various kinds of molecular studies and genetic studies, identified the genetic alteration that leads to a fusion protein. It's a translocation from a small region of chromosome number 19 to chromosome number 22 that leads to production of a fusion protein called BCR-able fusion protein. This particular protein has negative impact. However, if it is inhibited, and because of this understanding of genomics, tyrosine kinase inhibitors target this particular protein, and its impact can be completely obliterated. So this was the understanding from genomics that came, and today lots of the children actually survive. Unfortunately, there's also a bad news associated with this, that some patients become unresponsive to tyrosine kinase inhibitor therapy. And the reason was unknown for a very long time until more recently, about 5 years ago, when at least one set of understanding or one kind of understanding came about against the genomic studies. And what it turns out by studies of multiple children with this kind of cancer, a set of somatic mutations that associate with response to tyrosine kinase inhibitors. And these are somatic mutations; these are not germline mutations, and therefore it arises in these individuals, in these children, and are not passed on, but they afflict these children in adverse ways that therapy does not actually work. So increase in genomic precision by understanding these kinds of somatic mutations actually improves disease management. And these are children. I work on cancers, and these are children in the cancer hospital. They are performing on the foundation day of the cancer center, and they're quite happy. And these are all children with this kind of CML. This is the Saroj Gupta Cancer Center and Research Institute in the city of Calcutta, and that's the institute. And we are very happy that this precision understanding can actually make these children so happy, and they are able to work on their daily activities and enjoy their lives. One of the clearest messages from genetic studies is that cancer and many other diseases are much more biologically heterogeneous than originally recognized. And this heterogeneity leads to heterogeneity of clinical outcomes, leads to difficulties in management, responses to therapy, and also impact on survival. So it's important for us to understand the heterogeneity at the molecular level, and the Human Cell Atlas is actually enhancing our ability to understand the kind of heterogeneity that we have in these diseases. And this actually leads from a uniform therapy across the board of patients to risk-stratified screening and treatment, reduction of overdiagnosis, more personalized intervention, and that in turn leads to saving of expenditure on therapy, overall increase in the number of years of disease-free survival. So this understanding at the single cell level, the understanding of heterogeneity indeed helps. So the detailed molecular understanding of diseases in relation to normal health is impactful. Human Cell Atlas project is essentially trying to understand normal health. I'll skip this. It's currently the pinnacle of precision genomics. We're trying to define the human body cell by cell, understanding human biology at the deepest molecular level. Eventually, the information will enable even better disease management, will save on cost of treatment. Just giving you an example of that, reduce patient suffering, reduce anxiety of family members, and increase patient survival. So these health benefits, if they are conducted well with a proper understanding, proper planning, the health benefits that will accrue from this understanding of human biology will accrue to across geography, ethnicities, gender, and ages. That's what we believe is equity, and this must be thought through very carefully and planned very carefully. If we look at this particular graph that comprises various kinds of diseases, asthma, coronary artery disease, childhood obesity, etc. On the x-axis, we have the number of people affected in the US, and on the y-axis, we have a disparity ratio measured in a particular way. And what we see is that there is a high amount of disparity even when the number of people afflicted with the disease is not so high. This calls for a necessity or emphasizes the necessity of promoting research considering social, environmental, and genetic factors. And we need to do that to ensure that all individuals receive the right diagnosis and the treatment at the right time. And what we believe is that if this is conducted in a socially just manner, such that the rising tide of precision medicine lifts all boats, including groups that are disproportionately affected by the disease. And if you look at asthma, for example, where there is a high disparity, there is evidence supporting an association between air pollution exposure and incident childhood asthma, and that's inconsistent. The association is inconsistent and may actually depend on genetic factors. It's not just the extent of air pollution that's positively correlated with incidence of childhood asthma, but it's also dependent on genetic factors. So these environmental interactions are important for asthma development, and there's already some evidence of significant interaction of certain genes with air pollution. Genomics actually is falling on diversity, and this is the title of a Nature commentary published about 5 years ago, which reviewed a large number of US studies. And as a result of that, what we find is that it is impacting on various kinds of disease classes that one is dealing with, whether it's responses, whether it's autoimmune diseases, aging-related diseases, or even responses to various kinds of drugs, particularly anti-cancer drugs. There is considerable variation across populations, and actually ignoring these variations will result in health inequity. And so what in HCA, the idea is to be inclusive, and inclusivity is a cornerstone of HCA. The questions in cancer biology that are addressed by emerging directions with single-cell RNA sequencing are manifold, and we have learned various kinds of things through HCA's involvement in understanding normal human biology and also tumor biology, and this is providing us with greater insight into the formation of these tumors and how they develop, and as a result, they are actually helping us manage cancers better. The HCA roadmap is therefore to organize this in a collective way, in an inclusive way, study various systems, organs, tissues, regions, etc., and collect tissues from various sources across ethnicities, across genders, across age groups. These tissues are then both experimentally and experimentally data are generated, and computationally inferences are drawn from the data, and they are coordinated and organized in a major way through collaboration of funders, working groups, meetings, and so on and so forth. To promote equity, HCA is actively taking actions to share knowledge of consistent technologies by organizing workshops and roadshows in low and middle income countries. It's empowering scientists from underserved and less endowed countries to participate by engaging them as partners in research and translation, providing access to technologies, educating and building capacity, and in turn, people who are the leadership in HCA is being educated. We are also enabling provision of less expensive and more portable technologies and reagents preferentially to the lower middle income countries. The commitment of Human Cell Atlas to humanity is a set of principles that have been recently enunciated, and this was the initiative was taken by the Equity Working Group. It subsequently has been endorsed by the Ethics Working Group and also by the organizing committee. What we are studying, like I said, that we are studying cellular variation in healthy individuals. There are many different cell types in the human body, even in the same organ. Proportions of cell types can vary between, for example, males and females, children and adults, smokers and non-smokers, Bantu speakers of Africa versus Austroasiatic speakers of India, etc. So it's important to recruit individuals across these diversities. And the way that we recruit individuals, we recruit them through self-identification, but not by doing any kind of helicopter science. The focus will be or is on local needs through local collaboration. HCA membership is open to scientists globally. We are embracing, consulting, and working under the leadership of local scientists in local laboratories to the extent feasible. The samples that are generated are actually being analyzed in the local laboratories. The data storage, analysis, and sharing of results are being done again locally. It's stored in publicly accessible global databases, including and ethical standards, including local rules and standards are being followed. Personal identifiers are, of course, stripped from these databases. Collected data are analyzed using statistical and other bioinformatic methods. Local HCA investigators or other persons in the community are encouraged and trained to participate equitably in data analysis. The data that are being used, we recognize as potential for discrimination, and we explicitly state that race is a social construct and not a biological one. Therefore, we strongly oppose the use of these data on biological differences. These data show that there is a lot of diversity, but we oppose the use of these data on biological differences for social discrimination. How do we ascertain whether we are making progress in enhancing equity or in promoting equity? We are developing a set of metrics to measure and track over time. We are developing metrics to measure diversity of investigators who are participating in HCA, diversity of representation of donors of tissues and samples to HCA, the extent of populating the various databases with anonymized data from diversity of groups, and local benefits that accrue from participation and data. We believe that these metrics will actually help us track over time whether we are improving in terms of equity or dissemination of equity. Precision genomics is poised to provide the right care to the right individual at the right time to advance health equity, and HCA is advancing precision genomics and health equity. We have actually the principles that I just enunciated, that is not yet available in the public domain. It will soon become available in the public domain. But we have learned certain lessons as we are discussing Human Cell Equity and Human Cell Atlas jointly, and the lessons learned has already been put together, and this is appeared a couple of years ago as a comment in Nature Medicine, and this is open access and is available. So I wish to also finally inform you that equity is being promoted in multiple parts of the world through engagement of local scientists by way of training and by way of holding workshops, roadshows, etc. Several of them have been held. There was an initial equity strategy meeting in England, followed by a roadshow in Brazil, followed by another in Ethiopia. Most recently, even during the pandemic, when we were thinking of holding a hands-on training workshop in India, it could not have been, was not held because of the pandemic. It was held online, and this was organized jointly by our institute and the MIT. There were over 200 participants, and there were people from multiple countries participated in this online workshop, and the countries included Bangladesh, France, Germany, India, Pakistan, UK, and the US. There's another roadshow that's coming up very soon, which will be in Vietnam, followed by another in Saudi Arabia, and funding agencies are actually supporting us in holding these workshops and promoting equity and local participation in the Human Cell Atlas project. Thank you very much for your attention.